Thank you, Presiding Officer. Any life lost as a result of drug harm is a tragedy, and the Scottish Government is absolutely committed to implementing approaches that we know work to save the lives and reduce harm. The Drugs Death Task Force has published its report Changing Lives, which included 20 recommendations and 139 detailed actions for the Scottish Government to consider. The report represented almost 3 years' work with contributions from a broad range of people with expertise in the area, including those with lived experience. And I know the Minister is really focused on listening to the examples from people with lived experience. One of the areas that I have a particular interest in is tackling drug-related stigma, an area which does require action from all levels of government and indeed the wider population. The Changing Lives report actually states that stigma kills people. The report does focus a lot on tackling stigma and discrimination. Stigma is damaging, not only to the individual in terms of their mental health and their sense of self-worth, but it also discourages people from coming forward to seek the help that they need. Stigma is particularly harmful in rural areas where communities are often very tight-knit. Alec Cole-Hamilton has just mentioned that. Communities are very tight-knit and where it can be harder to seek treatment because of the fear of prejudice and discrimination. Section 38 of the Changing Lives report states that primary care settings offer a key environment in which direct care and treatment can be offered to people who are affected by harmful drug use. Treatment services offered by, for example, GPs, dentists, community nurses, pharmacists and pharmacy technicians can also help to address issues around access to drug treatment services in rural areas and therefore reduce stigma. I picked up the issue of stigma with National Education for Scotland to ask if education could be created and delivered as mandatory, perhaps an online module for all health and social care staff, including pharmacists and allied health professionals, not just stigma education for those working in alcohol and drug services. And yes, I will take
Sue Webber. I thank the member taking an intervention. If you recall, we had some quite harrowing evidence when I was on the Health Committee from people in your area of Dumfries about some of the challenges that they were facing at their pharmacists. So I'm just wondering what your comments are on that.
And we need to speak through the chair. Emma Harper.
Yep, thanks, absolutely. And from the conversation that we had in Health Committee, I did pick up that issue directly, and it's been something that we've actioned locally, and the Alcohol and Drug Partnership team are well aware of it, and they took action, and that has been dealt with. So yeah, thank you for actually raising that, Sue Webber. I am keen to explore whether mandatory education related to stigma will add to Scotland's work to ensure people can access the treatment that they need without prejudice and judgment, and I hope we can make progress. I think it's really important, based on my experience as a nurse and a nurse educator, just hearing the conversations from people that I've worked with in the past. Presiding Officer, one of the other areas which is crucial in supporting people both in treatment and to overcome stigma is peer navigators, peer support workers. Presiding Officer, these workers can and do make a difference to people's lives. The Changing Lives report notes that provision of navigator services across Scotland is patchy and coverage in the central belt is good, but rural areas again are less well catered for. I know that the Minister is very much aware that rural areas must be addressed, and I know she has engaged with both Dumfries and Galloway and the Scottish Borders and their Alcohol and Drug Partnership and the NHS area, so I welcome that. The expansion of navigator services nationally, supported by a comprehensive framework, standards and guidance, may help to remove the postcode lottery that many individuals now face when accessing services. Community-based service that links to the hospital navigator service are necessary. Knowledge of local areas is imperative for navigators. And I absolutely welcome and endorse the vital and important work that We Are With You are conducting, who use the peer support model. And I met with the local team quite recently in Dumfries at the Buccleuch Street Centre just last year. I would therefore ask the Minister for a commitment that peer support services will be supported and expanded, particularly in rural areas. Presiding Officer, in the Minister's statement to Parliament in November, she stated that she wanted to expand the scope of MAT standards so that they include treatment options for benzodiazepines. And I'm aware that there is current research, RE and naloxone equivalent for benzodiazepines, and I'd be interested to hear update on treatment options for benzos from the Minister. It doesn't have to be today though, obviously, but again, I know we are meeting soon. The Westminster war on drugs, Presiding Officer, has been an abject failure. Instead of solving problems, it has made them worse by stigmatising those who use drugs and creating barriers to tackle substance addiction. The UK Government's latest white paper, Swift, Certain, Tough, New Consequences for Drug Possession, sets out a three-tier framework for adult drug possession offences. These proposals are contradictory to the public health approach being taken in Scotland and could undermine aspects of the national mission if they are implemented here. I know the Minister for Drugs Policy has written to the UK Minister to express opposition to these policies being operated in Scotland, and I would challenge my Conservative members in this chamber to do all they can to make representations to their Westminster colleagues to ensure that policy does not impact on our approach in Scotland. Without reform of the law, efforts to tackle a drug crisis in Scotland will always be impeded, and this cannot happen. So I welcome the steps being taken by the Minister. I know it isn't a quick fix. I know this is a long-term work that needs to take place, and I know the Minister is working hard to support reduction of drug deaths in Scotland, and I look forward to my continuing engagement with the Minister. Thank you.